Hey guys, thank you for calling back. So, I know you all are very concerned about Grandma and her recovery. So, I did some research and I want to go over what has happened, what will happen after she gets out of the hospital and after surgery. But also, I want to talk about her living arrangements. But first, I will try to break down what the doctor said as best as possible so you guys can understand better. Uh, so, first, I want to describe the role of our skeletal system. So, our skeletal system is one of the most important systems in our body. It is made up of all our bones. It provides a base of support, and it also provides the ability to move. So, when you break a bone in your body, it makes it harder for you to move. So, when Grandma fell, that hard impact to her hip made it almost impossible to move. So when Grandma fell, she fractured her hip. What's lucky is it's one of the most common fractures. And it's called an intertrochanteric fracture. So what that means is it is 4 to 5 inches away from the neck of the hip joint. So it doesn't stop any blood flow to the rest of her leg, which is very good because we don't want any blood clots in the rest of her leg because that can cause immobility in the rest of her leg and she wouldn't be able to function the way she did before. So for surgery, what will happen is this fracture will be screwed together and connected and held with a metal plate, so it pushes and compacts the two bones together to make sure it heals in the right alignment. What it will look like is this. The reason why it was so easy for her to break her hip is that when you grow older, your bones become more brittle and weak. They start to lose their density, but we can fix that and help to make them stronger by taking lots of calcium supplements, having the proper diet of many proteins, and also taking vitamin D. So the vitamin D can help our body absorb the calcium. The common recovery time and process takes about 6 weeks to a year in the elderly. Now, her recovery time might take longer due to the fact that she has osteoarthritis, is a degenerative disease that causes pain in your joints all over your body. If it does affect her recovery time, it won't affect it by much. But if it does, there are ways to take care of that pain. Grandma can take any type of acetaminophen, which is basically just Tylenol. And she also can take NSAIDs, which is non-steroidal anti-inflammatory drugs, such as ibuprofen and aspirin. So those are some options for her dealing with the pain. Next, I want to talk about possible living arrangements and life after the surgery. So for the living arrangements, we have a few possible options, and I'm just going to go over them, and I would love your guys' feedback, and if you have any questions or concerns, please feel free to interrupt me. The first option is giving her a life alert. Now, with the life alert, she will be staying at her own house all by herself. And I don't think this is a very great choice for her. Because when you fall, you can be knocked unconscious. So I really don't like her being home alone. But the good thing about a life alert is that once you push the button, an ambulance will be there in less than 6 minutes. Hiring nurses to go stay with her at her house. The pros about this option is that Grandma can be helped at any time she needs it. So like if she needs assistance in the shower or she forgets to take her medicine, these nurses can remind her. The bad thing about this is that I know Grandma loves her independence. So she might feel like dependent on this nurse or that we're hiring her a babysitter. And I don't want to do that. But if it helps her safety and helps prevent another fall, I would definitely choose it. But we have more options. So the pros of her being at a nursing home or an assisted living center is that she can be constantly monitored and helped by the staff. That she can make friends and there's also so many activities because the staff there wants to make sure that they are always involved. Another pro to this is that there are always going to be PTs and OTs available so she can get her exercise in and make sure that she's doing as much as she can to make sure that this recovery process is speedy and as healthy as it can. The con here is that Grandma, even at age 76, really loves is what I think is most desirable. So the last possible choice that has lots of pros and a few cons that I think is most desirable and best fit for Grandma and her recovery is living with my family and me in our house. So some pros are that we can always watch her and make sure that nothing ever happens to her that's in our control. Now, we can also help her by taking her to her PT sessions and all of her different doctor's appointments. We can also keep track of her diet and all of her medicine. So with living with us, we can fall-proof the house and make sure to prevent a fall from ever happening again. After the fall might be very different and difficult for her to get used to. So the important thing is to just stay patient. If you have any questions or concerns or other ideas, please feel free to leave me your feedback. Thank you guys again.